Hi, and welcome new members. I'm Candice, and I'm here to guide you in your onboarding process today. Caring Touch Home Care is an agency owned and operated by nurses. Our five-star agency is a company that aims to hire dedicated and skilled caregivers like yourself. So, let's get started.
We are committed to providing high-quality, client-centered, and affordable home care services to our clients. Their individual needs are carefully assessed, understood, and met through the selective assignment of qualified, trustworthy, and compassionate personnel. All in the comfort of their own homes.
First, let's cover the basics of our handbook. In this handbook, you will find general policies on our expectations and objectives. This handbook is meant to familiarize you with Caring Touch Home Care and provide you with a summary of information regarding working conditions, benefits, and policies and procedures affecting your employment. More details are provided in the agency's policy and procedure manual, which is located in the agency office. You may review the manual at any time during office hours or you may request copies of individual policies and procedures, PNPS. In addition, selective PNPS will be reviewed with you during orientation, during training sessions or on an as-needed basis. Nevertheless, you are expected to be familiar with and adhere to all agency policies and procedures. The information provided in this handbook should not be considered as either an offer of employment or as a contract between the agency and you. It represents conditions of ongoing employment but does not guarantee continued employment. You are responsible for reading, understanding, and complying with the terms of this handbook. This way, you will know what the agency expects of you and what you can expect from the agency. You are encouraged to present any questions that you may have to your supervisor or to the agency manager. At Caring Touch Home Care, we strive for excellence. We aim to provide the best service to our clients as well as follow all state and federal mandates. In order to do so, we will need you to submit the following documents: acknowledgement of receipt of employee handbook, application form, background check authorization, banking information, confidentiality agreement, disclosure of conflict of interest, driver's license or other identification documents, e-signature form, I-9 form, medical information form, professional license/any other certification, references, resume, social security number, W-4, vaccination record. Please reach out to the office immediately if any of these documents will be delayed. Caring Touch Home Care ensures that all employees and contractors are paid on a timely basis. Our pay period occurs bi-weekly, that is, every other week. Currently processed through our ClearCare and Viventium software. ClearCare is the website that keeps track of the hours and rate of all employees. Viventium allows us to disburse payment after we export ClearCare data. Viventium is a cloud-based payroll and HR software designed for small to mid-sized businesses. It automates payroll processing, tax filing, employee self-service, time and attendance tracking, and benefits administration. You can be rest assured that all our payroll processes are fast and efficient. After you have provided us with your banking information, we will set up log-in credentials for your profile. This information will be sent to the email you provide. To view your payroll, simply follow these guidelines. Step 1. Visit viventium.com to see your personal account. That is viventium.com. Step 2. Log into your account by entering your email and password set up for you. Step 3. You are now able to see the wide array of features available. On your dashboard, you will be able to see your most recent pay stubs, as well as your accrued sick time. You can even request sick time on the website.
In this segment, we will discuss standards of conduct. To be compliant, all members of the governing body, management, and employees of the agency must comply with federal, state, and local laws, professional standards, and the policy or regulations of relevant federal funded healthcare programs. It is an act of fraud for employees to undertake in certain activities. For example, we have billing for services which are not provided, submit fraudulent claims to government or third-party payers, including claims for services that were not provided, claims billing for service that varies from the service actually delivered, claims for services that do not adhere with program or contract requirements. Also, making false representations to obtain programs benefits or make false representation to obtain payment for any service. It may also include inserting inaccurate information on medical claims and compensating another individual for referring clients. Concerns regarding fraud should be directed to the compliance officers or designee. Abuse. Abuse involves practices that are not consistent with sound service delivery and economic practices. Such practice could directly or indirectly result in unnecessary program cost or in payment for services which do not meet the standards of care or which are not medically necessary. Employees shall avoid all actual or perceived misconduct and shall report any noted non-compliance or risk potential disciplinary action. So, how can you report fraud or abuse as a caregiver? Allegations of Medicare or Medicaid fraud or abuse shall be reported to 1-866-666-7390. It is the responsibility of agency staff to report any cases of suspected or known fraud or physical abuse, report information, and fraud and physical abuse. Agency shall consider unacceptable conduct to include, but not be limited to, the following: falsifying personal education or experience information during the job application, falsifying job and character references, having a previous conviction or receive conviction for crimes committed, falsifying data on clients' charts and other agency records, falsifying information on billing services, using codes which are a violation of federal rules or regulation, destroying or altering agency and client records without authorization, exhibiting a behavior that reflects poorly on the agency, using, possessing, and or being under the influence of alcohol and illegal substances while on the job, being discourteous to clients, co-workers, healthcare professionals, and members of the community at large, possessing dangerous weapons or guns while on the job, doing malicious damage to the agency or client's property, conducting actions or activities which are dishonest in any way. All employees are required to keep certain agency information confidential and ensure that it is only shared with those individuals who are on a need-to-know position. The agency insists that all its employees practice high levels of confidentiality to protect information, which includes, but are not limited to, compensation and salary, client lists, benefits, performance appraisals, disciplinary actions, non-public business information, and or proprietary trade secrets.
This is a policy that outlines the health requirements for all field staff who provide care in a client's home or at a service location. The purpose of this policy is to ensure that all field staff meet the health requirements in a uniform manner. The policy requires that all field staff complete a personal health assessment, initial TB screening, annual TB screening, and hepatitis B vaccination or declination of such vaccination. The health information of all field staff will be kept confidential and secure in a separate location from their personnel record. A health attestation form summarizing the dates of all health requirements will be maintained in the personnel record of all field staff. The policy requires annual TB screening and periodic health examinations as determined by the Director of Nursing, (DON), per Centers for Disease Control and Prevention, CDC, recommendations. This policy ensures that all field staff meet the health requirements to provide quality care to clients.